Hi guys, I'm Alex McCraw with FullBucket Health, and we're really excited today. This is our performance vet session, and it's exclusive for our barrel racers. We're kind of peeling back the curtain, and we're hearing from some of the best vets in the industry. We're really excited to have Dr. Marty Tanner with us today. Dr. Marty Tanner is owner of Tanner Equine Sports Medicine and Rehabilitation in Millsap, Texas, and he keeps some of the winningest barrel racers at the top of their game, including our full bucket ambassador, Andrea Busby. And we also have Dr. Keith Latson, owner and co-founder of Full Bucket Health. So we've had our ear to the arena, to the futurities, to the rodeos. We're hearing from our ambassadors, and we've been really nailing down the questions that our barrel racers have as they're in their day to day, as they're on the road, any emergencies they're encountering, and we're putting those through to the vets today. So let's just start off, Dr. Marty, with daily routines. I think in the performance horse world, especially barrel racers, there's new tack, there's new trends every day. We pour money wherever we can in, where we think it'll shave the seconds off just a little bit.
Yeah,
And I think often what gets overlooked is kind of the day-to-day routine, what's going on under the hood, our nutrition care supplements that sets the stage for a better performance. You work with the top barrel racers in the industry. When you're looking at those elite programs, Dr. Marty, what as a day to day really sets apart as far as setting a horse up, for soundness and consistency? What are some things that stick out to you?
I think the consistency is across the board is important. Not only diet, but exercise, the routine for the horse, feeding schedules. And I know feeding schedules on the road can get a little bit hard to keep, but I think anything that you can keep as consistent as you can to mimic what that horse lives in at home keeps that horse more comfortable. And then that in turn is going to keep those horses from getting stressed, which will can affect their GI health, can affect their respiratory health, and it's certainly going to affect their performance. So keeping them in the water bucket, keeping them in the feed tub, and kind of keeping them relaxed as you can on the road is going to transfer to performance in the ring.
And I think that's also, a hot topic question we hear from barrel racers as far as, their feed routine and they're hitting the road. There's been this back and forth between, should I feed hay? Should I feed alfalfa cubes? Is it more consistent to feed alfalfa cubes, at home so I can keep that consistent on the road? Or should I be, packing as much hay as possible? What would be your advice to those people, to those questions?
Mimic what they do at home.
Mimic what you do at home.
I think cubes are easier to travel with. At least that's what my clients tell me, right? Because they're cleaner, they can carry, they don't have to change brands. They're not having to worry about, am I going to get hay here? Am I going to get hay there? Whatever the quality of that cube is, if you stay in that brand of cube, usually that's going to have some consistency to it. Some horses don't like them, and they want hay. And so, you can find hay on the road. You might have to, it's going to be a little bit more variable, I think. But I think what you can travel with is the best. But however I was going to treat that horse on the road. Now, I'm not saying 365, a horse has to be that at home. But if you're getting ready for the rodeo season, right, and you're getting ready to hit the road, you need to start mimicking, in my opinion, about 30 days before you leave. You need to have those horses dialed into what you're going to do on the road as far as their care goes. What supplements am I going to use? Are they going to eat it? How are they going to respond? And if I get low, can I find what I'm feeding on the road? I have some clients, sometimes they're feeding some, and I'm not here to tout or criticize a brand of feed, but you got to remember you're going to be on the road, and just because you can get it in Texas doesn't mean you can get it in Nevada or Colorado and so you don't want to be changing things on the road if you don't have to. So you can't possibly carry enough of that stuff to get you through the season, right? If you're going to leave and start your summer run and then go to the Northwest and then finish up, because you're going to try to get all the way back here by the end of September, you can't carry what you need. So you need to develop a plan that you can maintain on the road. And don't start it the day you leave or when you get to for your first stop. You need to get those horses introduced to it, let the flora of their gut adjust to it, make sure the horse is going to eat it, make sure it doesn't have any detrimental not necessarily detrimental effects, but there's some diets that, horses, if they're not going to consume, or if you have a horse that wants to tie up a little bit, you got to you need to be really consistent with those horses. So you need to have tried that ahead of time. On the road doesn't need to be the first time they've seen it.
Yeah, and
I'm
I think
assuming
with our barrel racers, they wanna do as much as they can for their horses. They pour everything they can into their horses, and so often with a supplement routine, honestly, sometimes they go a little overboard. They go,
Yeah.
you know
I tease them sometimes. I said, I don't know how they get any grain because you got a bucket full of supplements.
Yeah, and we see, we either see it's wasted or maybe they're honestly getting too much of one thing or their horses aren't eating it. So, what is your advice when they're looking at supplements as, kind of determining what's fluff and what's necessary?
Look at that individual horse. You brought up Andrea, right? So not every horse on that trailer gets the same supplement program because they don't need it. Some of them may need. I have some myositis horses, or if they have a tendency to want to get myositis, I have them on medical muscle. Well, that doesn't mean everybody on the trailer needs that. I think that you need to remember, so many times if they get a supplement, if a horse owner gets a supplement and they apply it to one of their horses that has a specific problem, and all of a sudden it makes a difference in that horse's life, we need to give it to every horse we own, and that's not necessarily the case. So I think that's where a lot of over supplement comes in play. And there's a thousand ways to skin a cat. If you look at a lot of those supplements, you may be giving your horse 4 different joint supplements.
Yeah,
So understand your supplement, understanding what you are supplementing, and try to make it meet the needs of that horse. If that horse doesn't have that need, that horse does not need that supplement.
I love that advice. And especially as we know, barrel racers want to put as much as they can into it, and it's often, unnecessary. So I
And
think
that's
that's great
understandable.
advice.
This day and time, it's a different rodeo world than it was when I started my career. They're better riders, they're faster horses, they're fed better, we have better medicine, they have better tack, they have better training. They can go on a YouTube channel and learn what they could not learn when I got out of that school. Nobody knew what YouTube was, but you've seen some changes. So it is a very competitive sport,
And they're
especially
also
at the upper level. They run 15 horses a night at the NFR. If somebody told you there was a different winner every night, you would believe them.
very
You know,
true.
yeah. So the detail matters. The
Mhm.
detail matters, and so we've gotten a little bit off course, but I think that's what leads to supplementation.
where do you find yourself, Dr. Tanner, as you're working with maybe somebody who's not at as high of a level as Andrea with her horses and her level of medical knowledge, given her background, with some of those younger riders or earlier in their careers? Where do you find yourself really giving them input on those details? Because the amount of detail that's out there can be so overwhelming. What are some of those common areas where you find yourself giving them a little bit of direction and trying to help keep them within guardrails?
I think that what I try to take advantage of is when their horse comes in and we actually do the medical exam and diagnose the horse and see what the specific issues with that individual horse is. I try to guide them in a direction of what that horse needs, but I want to take an effort to explain to them what that's doing for that horse. Um, and they need to understand, especially when I get young riders in, I always try to spend as much time as I can. I want them to understand a parent will bring a teenager in sometime, and I'll talk to the teenager, not the parent, because I want them to understand, because they're not always going to be a teenager, and they're going to and they get away from home and they get on the road. They need to understand, hey, I'm getting good advice here, or no, I'm not, and my horse needs this, or no, my horse does not, and why. And also, they need to understand what's going on with that horse so that they can make a change on the road, or make a change in it and recognize this is different. This is what I need to do in this situation to correct that problem, or correct this before it becomes a problem. Really is what you would rather do. And again, understand what they're supplementing and why. So I think
Pretty great. you take the time to help them with the
Yeah.
decision they create.
Yeah, I want them to learn because, they need to know because there's so much information to digest. And if they understand those products and what they do, and then understand sometimes a horse will come in and has a particular issue and we'll start a supplement. And that may not be a lifelong supplementation for that horse. It may just be, we need to get this issue under control and then we'll phase that out. So they need to understand that, understand why, and then recognize the symptoms. Okay, we were phased this horse off. We were good for a time. Now I'm starting to see this creep back in. So maybe we need to restart this. And that may be a decision they make on their own. It may be a phone call from me that they've recognized, hey, this hypothyroid horse, we got his weight under control and we were able to maintain he or she. But now I'm starting to see these symptoms kind of creep back in. What do I do? So,
I think an interesting part, we've talked about is Dr. Marty, your love for the racetrack, and Dr. Keith, you have all this experience on the racetrack. And I think it's really cool. The barrel racing world, we see we see those bloodlines keep tying back into the barrel horse world over and over. There's a lot of cow horse crosses. There's a lot of cool bloodlines that are in the barrel racing industry. And I think an interesting aspect is to Dr. Keith, in your experience on the track, some of those, hot running horses, what are some issues you maybe saw in the day to day with them that, correlate to our barrel horses that, you saw day to day routine? This is what separates the good from the great.
Sure. There's a distinct difference, I think, between how the thoroughbred racehorses are managed and the benefits that a lot of the performance quarter horses have, in that with thoroughbreds, oftentimes there's not really a season. So they may be pointing toward a race where they peak, but then they're right into training every day, 365 days a year. And so the opportunity that those horses have for a little bit of turnout and moving in different directions to really, really stimulate their musculoskeletal system in different ways, almost like cross training, are fairly limited unless they get injured and they're required to have layup or turnout. So I think that's one of the real benefits with the Western performance horses. And so what we would see in terms of injury or arthritic change or those sorts of things were because of that chronic repetitive concussion without much time to freshen up as horses. But in that day to day, everything is very, very consistent. The time of feeding, the time they go to the track, who they go to the track with, who their stall neighbors are, all of that's very consistent until they have to get put on a plane to go across the country or across the world. And so we would see a ton of travel stress with those horses. And that might manifest as, loose manure when they get off the trailer, and that could last for days or a week. They're on really hot feeds, high concentrate feeds. And so many of those horses lived every day with cow pie manure. And so they're always right on that nutritional edge of tipping over into a colitis situation or something worse. And so those are the kinds of things that we were always walking the balance of at the racetrack. And Dr. Tanner, I don't know if you see it in that sort of a pressure cooker situation, or if there are situations where you see those types of things more specifically, as horses are coming up into their heavy seasons, or as they're transitioning off of their heavy competitive seasons down into that layup time, whether that can involve some stress for them. I'd be interested to hear from you.
yeah, I think the layup seasons don't really stress us as much. But what I watch is, when of course, the northern horses are coming here for the Texas indoors, or the winter rodeos. And then we're going out to the west and, that area. So environmental swings, temperature wise, really affects those horses. Affects their water consumption, which in turn is going to affect their feed consumption. And, you get, they left Texas and it was 102 and they get up there and it's, 60 at night and 80 in the day. And, they're going to back out of that water bucket unless you're making some sort of concerted effort to make sure they don't. And usually that's in the form of some supplementation to try to keep them in that water bucket. So, we worry about those a lot because it's going to translate to how they perform in the pen. And when they get in that, particularly in that summer run, when it kind of kicks off with Greeley and Reno and that area, and they have no break. They may run 7 rodeos in 5 days, and so that takes a toll too, because they're having to eat in the trailer, they're having to drink in the trailer. And so there's their life is kind of not organized. It's not like strict feeding time, because feeding time might have been when they were running, and so then they cool them out, give them a bath, stick them in a trailer, and we got to be 10 hours by in the morning, so I think those stresses we have to deal with those, and you got to advise your client how to deal with that. And then some horses it doesn't bother them at all, which is, see some of these horses, they don't care, and then some it really does care. I don't know if that really dialed in your answer or answered your question, right? But
I think it speaks to the horse as the individual, and
it does.
There's a common theme here where, sometimes when we get into those bigger programs and bigger training barns, that's more of a program training where they all do get the same thing, and that individuality gets weeded out of the system, and so you have those horses that are a little girthy, or they just back out of their feed tub for what seems to be no reason, but they're just a little more sensitive than the others. And then you've got those that are bomb proof, and you can put them on a trailer overnight and run them again the next day, and they don't seem to be. It's really interesting that in my experience, at least, it doesn't seem to correlate with the age or experience of the horse.
Yeah, that horse is, I agree with you. I've seen some of those horses that typically are going to be good road horses. They're kind of good road horses, and the ones that are going to be hard haulers, they're kind of hard haulers from get go. And so you just got to figure out what that horse likes. And then you got to be observant of it. You can't throw it in the feed tub and go to bed, because it may be in there in the morning. But if you pay close attention, there's some tweaks that you can do, and kind of, there's also, you can develop a pattern with your individual horses. Like, okay, when my horse doesn't eat, if I do this, that horse will eat or will drink. So it is very individualized.
Yeah.
Yeah.
Yeah, I think 2 big things we've hit on are consistency, and you have to know your horse. You have to know how they behave to kind of know what works, what doesn't. And we're talking about some of the symptoms you see as these horses hit the road, as they're, going up and down from the heat to the winter. What are some red flags that you would tell, your clients to never overlook?
The number one is
Mhm.
water consumption.
Water consumption.
If those horses are hydrated, they'll typically eat, and they'll typically do fine. So you watch stool content, measure their buckets, how much did they drink? What do they normally drink in a day? Are they off of that? Are they on that? So I get asked the question a lot, and I know the questions that I don't mean to keep answering about the finals, but a lot of people use that as like the barometer,
Yeah.
and it doesn't mean that just because you're not at the finals, you're not important, but it just means that you can kind of take that extreme and apply it to your horse, and it can be useful to you. But I always get asked, what's the main thing you have to deal with at the finals? And they expect it to be some fancy answer. And I spend more time keeping those horses hydrated than I do anything else. Because if I can keep that up, everything else will take care of itself mostly. So watch their stool. Is it, the consistency of it, it matters. Is it soft or is it dry? They typically drink 2 buckets of water in the night, and you get there and they only drank 1. Don't blow that off. It doesn't mean you have to haul them in and hook an IV up to them, but it does mean you pay attention. Like, okay, at the next stop, did they drink enough water to overcome what they did not drink prior? I think but I think hydration is a big thing.
What are some of the strategies that you use for that horse that usually drinks 2 buckets but only drank 1? Are you suggesting that they use electrolyte pace? Are you suggesting just to increase that thirst, or is it really just a watch them wait situation? Or how do you approach that?
I try to get, if they're on the road, whether they're on the pro deal or just, going circuit road, whatever. If they're on the road, I think there's some things they can do. They need to keep powder electrolytes, in my opinion, in their feed. I don't necessarily like to put them in the water. I want to put them in the feed so that they eat them, so it makes them go to the water. I like for them to have electrolyte paste, because if we got to leave, we go to get our horse that morning, normally drinks 2 buckets, only drink 1. We're going to give that horse some electrolyte paste when we put him on the trailer. So it hopes that when we get to where we're going, that horse will drink. So I think both of those products are useful, a paste and a powder. I think powder is like routine. I like those horses to stay on some sort of electrolyte supplement, because I think you can help maintain their thirst. And then the paste to supplement. A lot of these horses are on Lasix, so post performance they need paste that's the quickest way to get it in them and the easiest. And I'll tell you another little thing too that kind of helps is I tell some of my clients, especially if I have a horse not a good drinker,
Mhm.
go to a hardware store and get you an RV water filter, little cylinder filter, screw it on in your water hose every time you water that horse. Even at home, before I tell you about getting them ready to leave, start using that at home, and it will correct the taste of that water, and it'll keep a consistent taste in that water. And those things are like $25. You can throw 2 or 3 at your tack room when they get throw them away, but they're threaded for a water hose to screw on them, and so you can screw it right on the end of the hose that goes into your bucket, and it kind of keeps that water tasting the same, because there's a lot of variance in that.
That's a golden nugget.
That is a golden nugget.
In 25 years of practice, I have never heard anybody suggest
They're
that.
just little
I've hooked
activated
them up to
charcoal
my
filters.
OV.
They
Yeah,
sell them at Ace Hardware. They're nothing. Yeah.
They sell like a horse version, but it's way more expensive.
Yeah, I know.
Yeah.
I know.
Yeah. It's definitely way better to go to the hardware store.
Mm-hmm.
So talking about, on the road, and you're saying, it's really important to have an electrolyte source like the pace. I know Andrea's horse I had an abscess in his neck last year, and I believe Goodbye got sick after Salinas. She had these different bouts with
Mm-hmm.
antibiotics last year on the road, and she said, she immediately went to the probiotic paste, gave 3 tubes a day, and they never got loose stools. So when it comes to, having those things on hand, what would you recommend they always have, like in their vet box? We've talked about electrolyte paste, the probiotic paste. If you're building someone's vet box and they're going on the road, what needs to be in there?
Well, they need some, in general, all across the board.
Mhm.
So they need some Banamine and need some Bute. Need a little Ace, probably some Rompum or Xylazine. You tell how old I am.
I still romping too. Don't worry.
And a little Dex, so and an antibiotic, and whether they want to use an injectable or whether they want to use an oral, like to use Equisol. This is a good general oral liquid, and it's encapsulated so that it kind of protects the gut a little bit. So that one's, that's a good one. Doxy's a good one. Some people, they want to give an injection, they'll use an Exceed, but you got to be careful that you don't get a little sore reaction site from that. So that in general, I think you need electrolyte paste. You need electrolyte powder. I like for them to have some FullBucket paste on hand. If they start antibiotics, start that. Or if you get in a stressful environment, or if that horse backs out of the feed tub, sometimes that's all you need to do to get them back in the feed tub. And if you have a horse that's a little sensitive to that, I like to keep the FullBucket pellets. Andrea will have some FullBucket pellet, and other clients. I'm to keep bringing her up, but my other clients, I'll say, and just make that a consistent part of that horse's routine, because, we think about antibiotics and that type of, in a sickness, throwing off a horse's GI tract and, the bacteria of the tract. Stress can have as much effect on that as antibiotics. You can't discard the fact, just because he's not on medication, that horse is not going to be susceptible to it. And that's another thing, your horse. Is this horse have kind of a sensitive gut? They're just like people. There's some people can't eat certain food groups. because it makes them sick. Well, that horse can be that way as well. And so I think finding out what that horse needs, like we talked earlier, keep it. Doesn't mean everything on the trailer needs it, but that individual horse may need it. You have some horses that put them in a trailer, they're going to get a soft stool, right? You put them on the road, they're going to keep a soft stool, and then a horse on either side of them has zero problems at all. So I think keeping that with you is a benefit. I think the water filter is a benefit. And then just some bandaging, because they're going to get scraped, kicked, whatever, and then you need something to treat a foot abscess. Most common thing you're going to see, out there, something to wrap a foot with, a little bit of drawing, whether it's an animal intex pad or can't get Ictamol anymore. So you get Magnapaste or, something, but to treat a foot abscess. And I think if you have that on board, you can get out of a situation, if you need more help, you can get more help. And then a good phone number to call.
That's right. I love that advice. One more hot topic that I think we hear a lot throughout the bro racing community is tying up. And I know you brought in medical muscle earlier. I think a lot of the times there's situations where, a horse is tying up and maybe the owner doesn't even recognize it at first.
There's a lot of subclinical myositis or tying up that goes on in those horses, especially those heavier muscle group types of horses. Mares, their estrous cycle influences their susceptibility to it. And so some of those horses, if it's a mare that has a tendency to want to do that, sometimes putting them on Regimate is a good idea, just so you can at least take one variance out of their life. But that is a very good point, because everybody they think my horse didn't get stiff after, he didn't get muscle sore. He didn't have dark urine, so he's not tying up. That's not always the case. And that's not diagnostic, because many of those horses, or they'll get some blood work and they'll say, oh, the CK was, it wasn't high. It was 800. Well, it shouldn't be 800, and so it doesn't take, I've thought about this in my hand. Do you have a phone in front of you?
I've got one in front of me.
You got a stopwatch?
I do.
Okay. Here's what I want you to do. I want you to hit start, stop, fast as you can.
All right. Let me go to my stopwatch. 0.18 seconds.
Okay. 0.2 of a second. As fast as he could hit it. How much difference does that make in a barrel race?
A lot.
A lot.
A
So
lot.
the little things, it doesn't, you think that, it doesn't have to be a big billboard. If that horse starts getting a little muscle tight from the third barrel home, that's all it takes to slow that down. So tying up is a big thing that you need to know. I shouldn't say a big thing. It's not like every horse experiences it, but the ones that do, it affects them. And you can have these horses I see that have a chronic low-grade myositis. And so anything you can do to try to keep that from being a problem for that horse is going to translate. It's going to stop the clock.
And Dr. Keith, how long does the horse have to be on medical muscle to see that difference?
Typically we start seeing real differences in those horses after about 30 days. It's not a silver bullet that you give it today and you see the result 2 hours from now, because we're really adjusting things down at the cellular and mitochondrial level. And so having some consistent inputs and consistent exposure to all of those ingredients, the astaxanthin, particularly in the medical muscle, it takes some consistent exposure to higher levels of that to really see the result.
Well, that's the great thing about barrel racers. If they start a supplement, they're gonna stick with it and they're gonna be consistent.
And there's some other things they can do too. I have some horses that it could be as simple as, 2 hours before they run, they give a half CCAs.
Mhm.
And they think, and that's not, you're never going to look at that horse and know you gave him 2 cc's of ACE, but it'll have an effect on them, and it can keep some of those horses from dropping into those episodes.
Yeah, some of the anxiety that comes along with there's a mental game for the horse in this as well. And I think one of the other things that I've seen fairly consistently at the racetrack is that horses that weren't warmed up as thoroughly as they probably should have been, particularly after they've just been doing some low grade jogging for, several days. and then they're going out to do something a little more intense. And I think this speaks to the weekend warrior type of horse. If those horses aren't warmed up adequately, their risk of tying up or having some even subclinical myositis is higher than those that are warmed up properly and just have a nice ascending rise into their exercise routine or into their workout or into their race. That's so important, the warm up and cool down.
That's great advice, Dr. Keith. Um, Dr. Marty, you're lameness king. You're known for your lameness work. Really
Or
excited. What, as barrel racers, as anyone in the Western performance horse industry, we want our horses to be as comfortable, as sound as possible. We want them to go as long as possible. We want them to, you know, perform. We baby them. We want to wrap them in bubble wrap. What is maybe something you see on the lameness side that you see it and it's going to cause a potential problem, or maybe like a red flag on the lameness side where, you can give advice to barrel racers on, we want to keep our horses as sound, as consistent as possible, and something to set them up for success.
A couple of things. I think, and I say things tongue in cheek because I don't want to get myself hung in the back of the clinic, but it's harder to hurt or injure a fit horse than it is an unfit horse. And I think that some of the things I see is because they're not exercised as much during the week, and then they go run on the weekends. And so I think fitness program is real important. And I'll have some clients that say, "Well, I ride them every day," but you got to ride them, and get them fit, because there's multifactorial. Not only does it help their muscles, but so I'll give you an example of this. Bleeders, right? Something we all deal with. So everybody knows I'm a thoroughbred goof. So there was a mare that run a few years ago named Gamine, a Bob Baffert trainer. She was phenomenal sprinter, right? So she was running a Breeders' Cup, and they had a camera on the mare, on the jockey, because they thought the mare was going to, unless she fell down, she was going to win the race. And so resting respiration rate on a fit thoroughbred horse, going to be, what do you say, 16 to 20, standing in the stall. The mare ran a race. They were interviewing the jockey, had the camera on his cap on the mare, and I'm watching the mare go out. And so, and so you can hear her breathing. So I checked her respiration rate, 180. So you go from a lung that's breathing 20 times a minute to breathing that. Just the physical expansion and contraction of that lung is traumatizing to the lung, especially if that's the only time they've experienced it. So during the week when you're running, if the only time that horse's lungs get stretched of that nature is during a performance, you're not doing that horse justice. You need to be sprinting. You need to be doing some sort of during the week. And look, it doesn't have to be for 15 or 16 seconds like in a run. If you just do it 5 or 6 seconds, so the elasticity of that lung gets used to the expansion and contraction at that high rate, you're going to have a lot less bleeding issues with those horses. Makes a huge difference, in my opinion. I've seen that with just if they're running on the weekends, sometime in the middle of that week, just a little spurt, third barrel home. That's all it needs. But I think that's important. Not only is it involving the fitness, Dr. Keith will tell you on a racetrack, you can lope a horse to death and he won't be fit. You have to put a little bit of speed work in there every now and then, but just controlled speed work. And you don't have to do speed work on a barrel. Straight line speed work is just as good, and it's less fatiguing on their legs. So, once a horse is trained, sometimes just fit and sprint and, riding a horse is probably better, actually. So to answer your question, horses that aren't fit and their lungs aren't used to the capacity that they're going to have to run in, that's one thing that I'll talk to clients about. And the other things are going to vary, conformation, talent level, of the horse. All those things come into play. Clients, I use like goofy illustrations, but I think if people can see, I'm very visual. If I can see it, I can understand it. And I always say, Those old wooden panel station wagons they used to make years ago, those things would run 80 miles an hour for 400,000 miles, right? They rebuild a NASCAR every weekend. So, fast horses get more problems than slower horses, so they got to be fit.
It's because that's something you can do. You have control over with your
You got to
horse.
put the work in.
Yeah.
You got to put the work in.
I think one of the things that I would add to that too is for the owners of these horses, really getting comfortable checking the legs and knowing every leg of every individual horse, because there really is a pathway that we'll see. There's a little bit of heat in a joint or in a tendon sheath, and then there's a little bit of filling to it, but there's no lameness yet. Then there's heat, plus there's filling, plus they flinch a little when you flex that joint. Then there's a little heat and a little filling, and they flex a little sore, and then they're just a hair off when they're turning to the right or the left. And so understanding the progression of those and intimately knowing all of those structures in a horse's leg, if we're able to find those things at the very forefront of them coming on, it keeps us from having to fight a blazing fire and just control a small one. And that's such a benefit for me as a veterinarian that really focused on legs and throats on the racetrack. Having those grooms who were so good at picking out just the small inconsistencies day to day, to be able to call me and say, "Hey, doc, can you look at this? It's different." Those are really important things that I value from clients that are super helpful for the horse's benefit.
I love that. I think that's another tip that's within our control. And I think often we make things too complicated. And I think those are two big ones that you can control the fitness of your horse, put the hard work in, and you can know your horse, know their quirks, know how their legs feel. So I love those two nuggets of advice. And Dr. Marty, you've given us so many valuable nuggets that I know the barrel racing community is going to love.
Well, I've enjoyed it. Yeah, I like doing it.
No, we
Thanks,
love it.
Dr.
And
Tanner.
thank you for being a wealth of knowledge.
I'll look forward to meeting you at AAEP if you'll be there.
Well, guess what goes on at the AAP every year?
NFR.
Oh, that's right. That's right. We got the overlap.
The only time I get to go to the AAP is when it's in Las Vegas.
Got it. Well, maybe at a resort meeting or something.
There you go.
We'll figure it out.